20%. That's the portion of UMRC's emergency medicine team that's left in the last year or so. Many hospitals have a similar story to tell, a troubling drop when hospitalizations are on the rise. To find out what's at play here, I talked with the chair of that department, Dr. Michael Kamali. He says the erosion began in earnest in January of this year.
Things were going okay, then really seemed to start to hit in the fall, this fall, particularly badly, where a lot of people have said, I've had enough. Difficulties with everything that was going on with schools, with stuff, and the anticipation of another surge, knowing that there was likely another wave coming. And that anxiety and stress associated with that, I think, really made it difficult for a lot of people. And they said, I just can't do this anymore. And a lot of the people stepped away from it.
What impact do you think the mandates have had on staffing?
So it had some impact, but I really feel that that impact was very minimal.
From my understanding, there's a domino effect. Those who are left have to work harder. The hospital system has to bring in travel nurses, and that can complicate things, if you wouldn't mind talking about that.
Sure. So the traveler nurses are excellent addition, but also poses some problems as well. If we lose a nurse, someone that we've worked with for many, many years, we lose really significant experience, someone that we know, that we trust, that can really read our minds to some extent, that when you're dealing with a patient knows exactly what to do and knows the system. A traveler nurse can fill in and is a great help, but you don't have that relationship that you might have had with someone else. And then there's the cost associated with travel nursing that costs much more than a nurse that you have in the system. So that exposes to me some of the problems. Maybe we need to look and give some thought to how we compensate our nurses, especially those in emergency medicine or those fields that are running 24/7. And I think about our ICUs, and I think about our emergency nurses that really have been working very, very hard.
Have you or anyone on your staff reached a point in the last few weeks, or I guess throughout the entire pandemic, but specifically most recently, where you've had to pick between two patients? And I can't remember the term that applies here, but basically you take care and you say we have to give it to one and not the other.
If there's a patient that's sick that needs a life-saving treatment, or there are two of those patients, we're doing everything we possibly can to provide it to all those patients. What that means is if you have something that maybe isn't as severe, you might be waiting a little bit longer than you would have otherwise. So everyone is working hard to provide everything we possibly can to any patient that needs it at any point in time. We haven't reached a point, and I'm hoping we don't reach a point where we have limited ventilators or we have limitations on medications.
Rationing care, that was the term I was looking for. Dr. Kamali does expect some folks to return to work next year. He's also pushing our federal representatives to consider health care as infrastructure so they can direct funding their way to improve facilities and make hospitals a better place to work and treat patients. You can watch the entire interview, and there's a lot more to it, over on rochesterfirst.com. It should be up by the end of this broadcast.